Hi, I'm Dr. Rick Mars, and we're at the Dental Care Group, and we're really excited because next week we have Invisalign Day starting at the Dental Care Group. And I'm here with a couple of my team members, Marlene, a treatment coordinator,
Hi.
and Jessica, one of our wonderful assistants here. And we feel you have to hear from the horse's mouth what Invisalign's all about. We tell you about it, but I think you should talk to a couple of ladies that are wearing it right now and how it is for them, what it felt like, what it's done for them, what it's done for their lives. So you can join us on Invisalign Day next week.
Okay, so Dr. Mars, before we get started with Marlene and Jessica, a couple of questions. How does Invisalign work?
Okay, Invisalign's amazing. Okay, it's an orthodontic system without brackets and wires. It's clear trays. Nobody sees it at all. And basically it uses a clear tray system where you change it change it every 2 weeks. And it gets you from your starting point to your finish point, which is as ideal as any orthodontic system can work.
And how long does the treatment normally last?
The average treatment lasts about a year to a year and a half. Some of the treatments as short as 6 months if it's a simple case without any major issues. And once in a while we get a very complex case that can run up to 2 years.
So Marlene, how long have you been in the Invisalign treatment?
Approximately 8 months.
What about you, Jessica?
I am at about a year now.
Okay. Dr. Mars, do you have to extract any teeth to do Invisalign?
Absolutely not. 99% of our cases don't require extraction. That's one of the nice features about Invisalign. It uses this amazing 3D technology, everything from the scanner to a virtual clean check is what they call it, so it shows you what your case finishes like. And when you see what it finishes like I said, 99% of our cases do not need extractions.
Can Invisalign close gaps between teeth?
Absolutely. That's one of the nicest features of Invisalign is how it will take care of what we call diastemas. Those are spaces between the teeth and keep them closed permanently.
Okay, Marlene and Jessica, you're wearing Invisalign right now.
Yes.
Does it make you talk funny?
No, not at all. I don't sound, I don't even, sometimes I even forget that I have them on. You can't feel it. You get so used to it when you're wearing them that it doesn't affect your speech at all.
What about you, Jessica?
Same thing. I speak to patients every day, and I've never had any problems or any type of speech problems with them on. I find them quite comfortable, actually.
Okay, is Invisalign painful, Jessica?
Not at all. The only thing that you would ever notice is just, you know, every 2 weeks as you go changing your trays, you'll just feel a little bit of the tightness for the first day, maybe 2 days, but after that, it's just the initial time when you put them on for the that first time, but that's it. There's no pain at all.
Marlene?
When I put them in, they feel tight, like they snap in, and then in a few hours, they feel, they settle in.
Are there any foods that you should avoid while wearing Invisalign?
Don't eat food with your Invisalign in.
No, you take them out to eat, so you can pretty much eat anything.
I mean, that happens to be one of the nice features of Invisalign versus braces. When somebody wears braces, when they go and have a meal, they're essentially wearing that meal in their teeth. With Invisalign, you take your Invisalign off. It's just like anybody else eats a meal. When you're done, you pop them back in. And that's the two things you take Invisalign off for, is basically to eat and to brush your teeth. For everything else, you wear your Invisalign.
And you can floss regular. That's the great part.
How often must you wear your Invisalign aligners?
22 hours a day. And you do everything in them except eat and brush. You sleep in them, you work in them, you exercise in them. Everything you do with your Invisalign except eating and brushing your teeth. And no gum chewing either.
Okay, so Marlene and Jessica, so tell the truth. How often do you wear your Invisaligners?
Well, I eat frequently, but I don't keep them out very long when I'm eating. I've noticed that if I'm drinking something, if it's dark, like and I don't know whether this is true or not, but I feel sometimes if it's dark, you can see that I'm drinking coffee, so I'll take them out to drink coffee, but, do it right away. Although Dr. Mars told me I should drink it with a straw. I'm gonna try that now.
Jessica?
I tend to eat a lot throughout the day too, so I probably take them out more than I'm supposed to, but usually I always try to remember to keep them in, especially when I'm going to sleep. I don't want to forget and, you know, not fall asleep with them in my mouth, but usually
Pretty
they're
close.
always in my mouth.
Yeah.
I don't know when you guys have so much time to eat.
I know.
Will cigarette smoking stain the aligners?
We haven't had a problem with cigarette smoking staining our patients' aligners. There's two issues. Number one, these aligners get changed every 2 weeks. I guess if you are just a chain smoker, it might start staining the aligners, but you brush the aligners like you brush your teeth. That's the maintenance on aligners, just to brush them. So if you're a heavy smoker, you can brush them, you can put them in denture cleaner, but we really haven't seen an issue, like I said, because people tend, you know, by the time that they start picking up any stain, you're changing them at that point. If you eat with them in your mouth, which you're not supposed to do, that can give you some discoloration with your aligners, but we instruct you not to do that, so if you don't do it, your aligner won't stain.
And how do I clean my aligners?
Just brush them, just like you brush your teeth. When you're brushing your teeth, you brush your aligner. If you really want to get them super clean, once in a blue moon, a patient will drop them in, like I said, a denture cleaner or something, but that's very rare.
And Marlene and Jessica, is that how you clean your aligners?
Yes.
Yeah.
Okay.
Brush them in, out, yes.
How often will I have appointments with Invisalign?
We tend to see our patients every 6 to 8 weeks, just for a short check appointment. Their appointments are generally about 15 minutes. So you usually come in, get out relatively quick, and that's the average check appointment for Invisalign.
What happens after my treatment is complete? Do I need retainers?
Great question. Most of our patients wore braces when they were younger, and the reason that they're in Invisalign today is because they didn't wear retainers. Every orthodontic system requires some retainer system, either a permanent wire retainer or an Invisalign style retainer that you just pop in at night to sleep with. So the answer is yes, you do need to wear retainers after having Invisalign or any orthodontic system, because teeth have memory and they will go back to where they were.
And what are the advantages of Invisalign over braces?
Countless. Okay, we mentioned number one, when you eat normally. Okay, your food does not get stuck in your teeth. Number two, you brush and floss normally, like Jessica said. With braces, you cannot floss normally. You have to fish the wire underneath your braces with a floss threader, and it becomes a very difficult thing to keep your teeth clean with braces. The next thing is, Invisalign cases tend to be just a little bit quicker than regular orthodontic cases. Generally, orthodontic cases run about 2 years. Invisalign cases generally run about half the time. That's a big factor. And last but not least, these two ladies will show you, they're wearing Invisalign right now. Socially, wires and brackets are not acceptable in today's society. And these guys are in people's faces all day long, and people don't even know they have it on. It is virtually invisible. So wires and brackets in the adult population is really something that is a big faux pas. Or maybe that's not the best, it's not really the best socially acceptable thing, especially in the singles world. Most people shy away from wearing wires and brackets when they're dating. So Invisalign really provides something that can help people get their teeth straight and look great and not worry about the downside of wearing braces.
Could I
And
add
when you
something to that? I wanted to add something
I was
to
gonna
that.
do the same thing.
My thing was, I didn't want the cement that they use on all of my teeth. I didn't want to have that placed on my teeth. So that was another...
With braces.
With braces,
Right,
correct. Yeah.
Another thing is that when I wore braces long time ago, and they gave me a list of things I couldn't eat. Bagels, chips, popcorn, Oreo cookies, name it. I couldn't eat it. Chew gum, nothing like that. So, you know, with the Invisalign, you take them off, you eat what you want to eat, and then you brush and put them back on.
Yeah, another problem with orthodontics, brackets are always popping off, unfortunately. You eat the wrong thing, you bite down on a nut wrong. That doesn't happen with Invisalign. Nothing you have to worry about.
Okay, what happens if I lose an aligner?
You lose an aligner, you go back to your one previous aligner, call us up as quickly as possible, and we order another set of aligners from Invisalign for you.
Okay. And I understand, Dr. Mars, that you have Invisalign Day coming up and you have a special offer. Do you care to tell us about that?
Well, we're giving away a free iPad, with every case. We give whitening for life as long as you stay a patient in this office. And for these Invisalign days, we're offering $500 off our regular fees. So come join us, because it's probably the best prices, best deal you're going to get on Invisalign anywhere, and certainly in our office all year long. And we want to change your smile and make you have a great smile like these guys. So.